Now we are going to demonstrate to you some containers which are used in the collection of urine specimens. These are the same containers that can be used for collection of sputum and other specimens also. So this is a sterile screw capped wide mouth container. So you can see here it has a screw cap, a wide mouth, and because of the screw cap it will prevent leaking of the sample, and you can see inside the specimen and observe the color and consistency of the specimen when it is collected to a transparent container. There are similar different types of commercially prepared containers. So this one is again a screw capped container, but the mouth is relatively smaller, so it is difficult for patients to collect urine into this kind of containers. The ideal container is this one. So if you don't have it, you can use either of these. And this is again another container which is available in the laboratory, where we have used Marmite bottles to collection of urine, because this has a screw cap and it will prevent leaking of the sample. The disadvantage with this bottle is that we cannot see the color or the consistency of the sample inside. So if there is no other commercial prepared samples, you can also use this following proper autoclaving cycles. So if it is sterilized, then it is also okay to use a screw capped container like this. So ideal one is the commercial prepared container which comes with a seal. So until we open it, there is a seal which says sterile. So once we open the container, the seal is broken and it indicates that it is no longer sterile. So this type of containers comes with a packing, and once you break the packing and open the lid, the sterility is not there any longer. So these are the containers which you can use to collect samples from a patient who is not on a catheter. You can give this container to the patient and ask to collect the sample of urine. So when you give the sample collecting container to the patient, you have to give clear instructions to the patient. You should advise the patient to clean the genitalia properly with soap and water and dry, and then pass the urine sample into the container. The patient should collect a midstream urine sample. Midstream means not the initial part of the urine and not the last bit of the urine that comes out, the middle of the stream that comes. You should tell the patient once the patient starts to pass the stream of urine to open the lid and collect it into this container. Then invariably the initial part of the urine will come out, and the patient can collect the sample into this container, and carefully, not touching any other areas, you should collect the sample into this container and then close the lid and hand it over to the ward. In the ward, you should label the sample with the patient's name, details, BHT number, age, ward, hospital, etc. And this should be accompanied by a proper request form which also states the patient's details and also a little bit about the history and antibiotic usage of the patient. This can be used in an adult patient who is compliant with the given instructions. But if it is a neonate or a small child, you have to advise the mother how to collect the sample. So similarly, you should tell the mother to clean the baby's genitalia thoroughly with soap and water and dry it, and then keep the sterile screw capped container in hand without opening the lid and wait until the baby starts to pass urine. And when the baby starts to pass urine, let the initial stream go off and then quickly hold the container to the flow of urine in the mid of the stream, and then collect the sample into the container, and once it is collected, close the lid quickly. The mother should not touch any other areas of the baby with the open container and the lid, and then quickly close the lid and hand the specimen over to the nursing officers. So once it is handed over, it should be labeled properly with the patient's details, indicating the patient's name, age, BHT number, ward, etc. And also the request form should indicate the patient's details, the history and the antibiotic usage of the patient. So that is about a neonate. And also there are some other conditions where you suspect renal TB. So in renal TB, you need to collect the whole urine sample, and because renal TB is a infection with a low organism load, you have to collect multiple samples, and it should be the whole urine sample, that is the complete urine sample. So in order to collect the complete urine sample, you have to give a large container to the patient. So these are in-house prepared containers, which are used bottles which have been autoclaved and prepared to be used on patients to collect urine samples. You can give 3 of these bottles to the patient and advise the patient again to clean the genitalia with soap and water and without using any disinfectants, and collect the complete sample of urine when the patient wakes up in the morning. So when the patient wakes up early in the morning, it is the time that the organisms concentrate in the urine. So that will give the best yield of a sample when it is collected in the early morning. So you can tell the patient to collect the sample as soon as the patient wakes up in the morning into this container. So the whole sample of urine, complete sample of urine, should be collected into this bottle, and it has to be collected on consecutive 3 days. So day 1, day 2, day 3, all samples should be collected, and until day 2 and 3 are collected, you can advise the patient to keep the urine sample in the refrigerator, and once all 3 are collected, you can ask the patient to bring all 3 samples to the microbiology laboratory and hand it over with the request form given by the doctor. In the request form, there should be clear details of the patient's name, age, BHT number, etc. and also the patient's clinical history and about antibiotic usage, anti-TB usage for tuberculosis patients, and there should be a label on the specimen container also indicating the patient's name, BHT, etc. And it should be handed over to the microbiology laboratory. So you can keep it until transported in the refrigerator, and it can be sent on each day that is collected if it is a patient who is hospitalized.